Time for how I almost in Florida. So she brings this dessert and I say, is there any nuts in it? I have a severe nut allergy. Absolutely not. We don't even have nuts in our kitchen. I think perfect. Okay. At least we got a nice dessert. Okay. I take a couple bites. The second bite I take, something's crunchy in there. And I'm like, oh, okay. I spit it out and I'm looking at it and I'm like, that's a nut. 100%. Like, I know what a nut looks like. I've had the allergy for 24 years. And that's a nut. Okay? My friend looks at it and she was like, that's a nut. And I was like, okay. I'm trying not to freak out because when I eat nuts, I go into anaphylaxis. And which has never happened to me in a restaurant before, ever. Okay? So I go into anaphylaxis and I'm freaking out. And so the waitress comes over. She's like, actually, there might be nuts in it. And I was like, you don't say. I just ate one. She goes, let me see it. I showed it to her and she goes, I don't think that's a nut. I said, okay, because my throat is closing up right now. So I'm taking Benadryl. I don't like to take my EpiPen because if I take my EpiPen, I have to go to the hospital. If you go to the hospital, you have to pay for a hospital visit. Okay? I can't afford that. Not at the moment in my life. Can't afford it. So I don't go to the hospital. Okay? I take a Benadryl. I'm freaking out. I'm having a full panic attack right now. No one asked me if I'd like a glass of water. No one asked me if I needed medical attention. No one even said, hey, are you okay? Not a single person except the valet.
Hi, my name is Dr. Rubin. I'm a board-certified allergist. I am glad that she's okay at this time, and I'm so sorry that she experienced this situation. I do want to raise awareness to a common misconception which was mentioned in this video, which is that if you use epinephrine, you go to the emergency room not because of the medicine itself, but because of the reaction that you were treating. So if you suspect you're having a systemic allergic reaction known as anaphylaxis, use that epinephrine. And whether you go to the emergency room or not is determined based on your conversations that you have with the prescribing doctor, that you should be trained to know if it's something that you should be doing, because now the current evidence-based guidance is moving away from universal activation of 911 and going to the emergency room. In some cases, if you're doing really well, you may be able to monitor it safely at home. But the reason why for especially children and those who are nonverbal, that you go to the emergency room is to make sure that you need multiple doses of epinephrine and to monitor closely. If you use 2 doses of epinephrine, you definitely need to go to the emergency room to make sure that everything is okay. But this is an important point to make, that if you are prescribed epinephrine, make sure that your doctor is talking to you about these updated recommendations.